La nostra rubrica 2 minuti con ha oggi un ospite eccezionale, il dottor Todd Ellenbecker, che è un clinico e direttore di fisioterapisti in Arizona, Stati Uniti. Si occupa da molti anni dei giocatori di tennis, dei giocatori di baseball e dei giocatori in genere overhead col movimento dell'arto sopra al campo. Vorremmo chiedere a un così grande esperto, Todd, quanto è importante la riabilitazione per il giocatore professionista e per il paziente normale non professionista.
Yes, we in America presently we do a lot of non-operative or conservative treatment, and I think what's very important for patients to know is that sometimes this can take a pretty significant amount of time. Sometimes their patients will come for 3 or 4 visits and think it's not helping. Why isn't physical therapy helping? As you know, we spend a lot of time with manual therapy, stretching, mobilization of the joint, and also, particularly for shoulder injuries, a lot of time looking at rotator cuff strength and scapular strength. And to make changes, as you know, it takes a long time. It can take several months of rehabilitation, both home exercises as well as treatments in the clinic.
Home exercise.
Yes, and it's very, very important. So we place a great deal of emphasis on rehabilitation with these shoulder patients. Surgery can sometimes be indicated if the patient fails several months of rehabilitation, but most American doctors don't want to do surgery until the patient has tried a significant amount of rehabilitation first to be sure that they're strong.
Yeah, thank you. And the second question about therapy. Che cosa si intende negli Stati Uniti per trattamento conservativo? Laser, terapia o esercizio?
We use modalities like electric stimulation, ultrasonido, things like that to decrease the inflammation, decrease pain. But truly we found the most important has been the mobilization, the manual therapy with the therapist, with the patient, and as well as the strengthening programs. And we've heard at this conference here how important worldwide our understanding is of endurance. So when patients are doing exercises, we don't use just one set of 5 repetitions, for example. We want to make sure that the patient is doing a lot of exercise so that we have endurance of the muscles, because the muscles have to hold the shoulder and support the shoulder over a longer period of time. And so if patients are focused on maybe only doing 5 or 1 set of 10 repetitions, we find that's just not enough to get the changes in the muscle. So currently our thinking is that the manual therapy and the strengthening are the most important things that we do in the rehabilitation.
Ancora una domanda, Todd, che cosa accade? Qual è il futuro per un giocatore professionista se ha una tenotomia spontanea del capo lungo del bicipite?
Yes, we're starting to see that more and more, but as you know, it's an area of much controversy whether the bicep should be cut or if it should be cut and relocated, which we call in America a tenodesis. When the patient has when the patient has the bicep tenodesis, they have a very good future. The prognosis is quite good, but we certainly have to have the patient go through a series of rehabilitation to strengthen the other muscles around the shoulder complex, as well as work with the therapist on manual therapy to get full range of motion. That's very, very important. But I think something to emphasize is that with proper rehabilitation, the patient with a bicep tenodesis does very well following rehabilitation.
And without tenodesis? E senza tenodesi?
Yeah, you mean just a tenolysis where they cut it. They do very well.
Spontaneous.
Yeah, spontaneous. If it just tears, they do very well as well. As you know, the bicep long head is not that important for shoulder function. For elbow function, yes, but not for shoulder function. So people do very well without the bicep. That's why the physicians can cut it. It's actually okay not to have the bicep. They can go back to full function, but it does require some rehabilitation.
Okay, thank you very much.
You're welcome.